And we have a health alert from the state. Today, the Virginia Department of Health announced 2 children have died because of the flu. This comes as flu cases steadily rise across the state. Emily Harrison is in the studio now breaking down some of those numbers. Emily, you're also learning more about the 2 children's deaths.
Yes, VDH leaders say that one was a teenager from the central part of the state, another a 5 to 12-year-old who died here in the eastern region of Virginia. The state's health commissioner put out a statement offering condolences for the 2 children's death, saying it is a sad reminder for parents.
According to the latest data from the Virginia Department of Health, more than 17% of all emergency room visits are because of respiratory illnesses. From that number, data shows children make up the majority of emergency room visits. And now 2 Virginia children have died during this influenza season.
VDH tracks pediatric mortality as it relates to influenza as a mark for how serious the season might be. So these first 2 deaths are sad news for multiple reasons.
Lisa Sollitt, the respiratory disease program coordinator with VDH, says even though the threat level in Virginia is still considered moderate, about 14,000 people have reported symptoms of influenza throughout the state. Sollitt says these are the warning signs the VDH is looking for when they track cases of the flu.
What we are seeing right now is some of our indicators, like those pediatric deaths, that are showing us that flu is spreading in Virginia right now, and that we should be taking those prevention measures.
Those prevention measures include getting a flu vaccine. Solid says only a third of Virginians have a current flu vaccine, and that number is not where health leaders want it to be.
The best thing that you can do to protect your health and your children's health is to get vaccinated. Most individuals age 6 months and older are eligible for a vaccine, and it is not too late in the season to get one.
Again, doctors say children are not only more likely to have more severe symptoms of the flu, but are more likely to get it in comparison to adults. Physicians say it's time to have that conversation again about washing your hands and not touching your face. Emily Harrison, 13 News Now.
All right, and if you're interested in getting a flu vaccine, you should talk to your healthcare provider, or you can call VDH at 877-829-4682.